It's 2 in the morning. You hear a cry, touch a hot forehead, and suddenly face a high-stakes choice with no clear answer. You're weighing 2 immediate options: packing the diaper bag for the emergency room or staying home to administer a dose of acetaminophen. Overreacting comes with a cost: expensive ER bills, hours in a waiting room, and exposing your child to hospital pathogens for what might be a simple viral infection. But underreacting is a risk too. Staying home could mean missing the window for early intervention on a fast-moving bacterial infection. Parents cannot rely on panic or guesswork. Navigating this safely requires balancing financial resources and emotional bandwidth against the child's immediate medical needs. To lower the tension, start by viewing the fever as it is: a normal, healthy immune response to an invading infection. Much of the anxiety parents feel comes from a conceptual problem known as the fever misalignment. The left column shows what parents typically focus on: the exact number on the thermometer and how quickly it spiked. Now look at the right column. Doctors use these metrics to assess danger: the child's age bracket, lethargy level, and hydration status. Focusing on a thermometer can lead to false alarms. Shifting your attention to clinical markers is a more reliable way to distinguish between a common cold and a potential emergency. We can organize these markers into the triage algorithm, a flowchart determining next steps based on age and red flags. For babies under 1 month, there's no room for observation. This zero-tolerance zone leads directly to an immediate ER visit. Newborns have highly undeveloped immune systems. Because of this, a minor infection can escalate into a serious complication without any visible warning. For parents of newborns, the trade-off is clear. You accept the hassle and invasive testing of a hospital visit to prevent a rapid, catastrophic illness. The second branch covers babies between 1 and 3 months of age. While the risk of severe complications is lower here than in newborns, these infants still require a medical evaluation. The speed of that evaluation depends on the presence of physical warning signs, or red flags. If they are present, you head to the ER. If not, a next-day appointment is usually appropriate. Mastering this step ensures you don't overlook a bacterial infection, though it requires you to be diligent in screening for subtle physical cues. This brings us to the most common group: children between 3 months and 3 years old. You can safely choose home care here if the child is fully vaccinated, looks generally well, and shows no behavioral red flags. In this scenario, you can safely monitor the child at home for 2 to 3 days while managing the fever with the correct dose of acetaminophen. Most infections at this age, like simple colds or mild stomach bugs, are viral. They don't require antibiotics and will often resolve on their own. You must watch for triggers that require immediate escalation: new red flags appearing during observation, or a fever that doesn't respond to the correct dose of fever-reducing medication. For toddlers, the home care route saves you significant time and ER costs, but it requires continuous vigilance over the child's behavior and fluid intake. The entire algorithm relies on one thing: knowing exactly which red flags to look for. This checklist is the red flag gate. The first set involves breathing and intake: noticeable difficulty breathing, refusing to feed, or a drop in urination. Neurological and physical signs include severe lethargy, floppy muscle tone, blue lips or skin, neck stiffness, and seizures. For older babies and toddlers, the child's overall condition, as measured by this checklist, is the definitive sign of danger. The actual number on the thermometer is often less important than these behaviors. Using this checklist before heading to the car is the key to making an objective decision under pressure. The rule is non-negotiable. If even a single box on this checklist is ticked, the child needs immediate medical attention, regardless of their age. By replacing a few minutes of panic with a clinical observation, you can manage your resources effectively, while ensuring your child receives the specific level of care they need.